In this video, we will explore stem cell therapy, a new paradigm in the treatment of autoimmune diseases, one of the most representative intractable conditions which, unlike conventional treatments, has been producing many meaningful results. You might think that stem cell therapy is impossible in Korea due to stricter regulations compared to other countries, but I will explain the legally approved and available autologous bone marrow stem cell therapy methods that are possible domestically. First, as I see patients in the clinic, I'd like to briefly address some common misunderstandings people have about autoimmune diseases. There are quite a few people who think that autoimmune diseases are caused by a weakened immune system. While that's not entirely incorrect, to clarify a common misconception, autoimmune diseases occur when the immune cells that are supposed to protect our bodies not only attack external bacteria or viruses, but also mistakenly attack our own tissues, triggering an immune response that can damage our own body. In other words, it's a situation where the immune system malfunctions. Therefore, when describing autoimmune diseases, it's more accurate to refer to them as inappropriate, excessive, and overactive immune responses, rather than simply saying that immune function has declined. However, it's not entirely wrong to say that immune function has decreased. This is because in many patients with autoimmune diseases of unclear origin, it is found that they have suffered from severe stress for a long time, and due to problems in the autonomic nervous system caused by this stress, immune function can be weakened, which may lead to the development of autoimmune diseases. In fact, when someone experiences severe autonomic nervous system disorder due to stress, changes can be observed in their immune cells through blood tests. Among the main types of immune cells, there are granulocytes and lymphocytes, which are both types of white blood cells. Granulocytes remove large foreign substances such as bacteria or dead cells by engulfing them, while lymphocytes deal with smaller foreign substances like viruses by producing proteins called antibodies. Granulocytes contain adrenaline receptors, whereas lymphocytes have acetylcholine receptors. When the sympathetic nervous system is chronically activated due to ongoing stress, adrenaline secretion increases and the proportion of granulocytes among white blood cells rises. For optimal immune function, a proper balance between granulocytes and lymphocytes is important. However, when granulocytes are chronically elevated, they don't just attack external invaders. They can also start attacking the body's own tissues. This very process is the mechanism behind the development of autoimmune diseases, which is why autonomic nervous system dysfunction can be one of the causes of autoimmune disorders. There are over 100 types of autoimmune diseases, depending on which organs are attacked by granulocytes, but the treatment methods are largely similar. Generally, medications are used to relieve inflammatory pain and reduce immune responses, but because relapses and worsening often occur repeatedly, treatment is truly not easy. Moreover, there are significant side effects associated with the long-term use of steroids or immunosuppressants, which are used to suppress immune responses. The autologous bone marrow stem cell therapy I am going to talk about today is emerging as a new paradigm for autoimmune diseases, which have so many limitations in treatment. This is not just my personal opinion, but a global trend, and I would like to introduce a related research paper. Currently, autologous bone marrow stem cell therapy for autoimmune diseases is being actively conducted, especially in Europe. Since the mid-1990s, in Europe, an organization called ADWP, which studies autoimmune diseases, has established a database on blood cell and bone marrow transplants, analyzing the results of stem cell therapy for autoimmune diseases and even providing some guidelines. This database includes about 3,300 patients with autoimmune diseases. Since about 3,100 of these patients received autologous bone marrow stem cell therapy, I think it's fair to consider this a textbook case for autologous bone marrow stem cell treatment of autoimmune diseases. According to a paper published last year, most of the countries actively performing bone marrow stem cell therapy for autoimmune diseases are in Europe. As you can see in the figure, Italy, the UK, Germany, Sweden, Spain, the Netherlands, Poland and France are some of the representative countries. And every year, the number of bone marrow stem cell treatments for autoimmune diseases is steadily increasing. Among these, the diseases for which treatment is relatively active are multiple sclerosis, systemic sclerosis, and Crohn's disease. To briefly introduce these three representative diseases for which the effectiveness of bone marrow stem cells has been proven in recent research papers. Multiple sclerosis is an autoimmune disease that occurs in the central nervous system, which consists of the brain, spinal cord, and optic nerves. It is a disease in which chronic inflammation leaves scar tissue in various parts of the nerve cells. As a result, it affects all types of nerves, including sensory, motor, and autonomic nerves. Systemic sclerosis is an autoimmune disease of unknown cause, characterized by immune abnormalities, vascular damage, and fibrosis. In 2013, the American and European Rheumatology Societies presented new classification criteria for the diagnosis of systemic sclerosis. Looking at those criteria, the main symptoms and signs include Raynaud's phenomenon, skin sclerosis, swollen fingers, sclerodactyly, digital ulcers, pitted scars at the fingertips, telangiectasia, nail fold capillary abnormalities, pulmonary arterial hypertension, interstitial lung disease, and autoantibodies that are specifically seen in scleroderma. Each factor is assigned a different weight, and if the total score adds up to 9 or more, a diagnosis of systemic sclerosis is made. And Crohn's disease is a chronic inflammatory condition of the gastrointestinal tract, particularly affecting the lower small intestine, or the colon, or sometimes both, and it is an inflammatory bowel disease that can impact any part of the digestive tract. In cases of severe autoimmune diseases where the use of steroids or immunosuppressants reveals the limitations of treatment, a new concept of therapy is emerging, particularly in Europe, which utilizes the immunoregulatory functions and tissue regeneration abilities of autologous bone marrow stem cells, and its indications are gradually expanding. Because this treatment is based on the patient's own stem cells, there are almost no side effects. Another major advantage is that it tends to provide relatively long-lasting effects. In the research papers, the mechanism that makes this treatment possible is described as reset and rebalance. This means resetting the malfunctioning immune system and appropriately harmonizing the ratio of granulocytes to lymphocytes, in other words, rebalancing the system. At Osang Neurosurgery, we also provide stem cell treatment for patients with autoimmune diseases. The treatment results seem to be similar to those presented at various academic conferences. Additionally, our strength lies in injection therapy that balances the autonomic nervous system, which itself plays an important role in regulating immune cell function. Therefore, we combine this therapy with stem cell treatment for patients with autoimmune diseases. Since foreign stem cell clinics generally do not pay much attention to this autonomic nervous system injection therapy, it could be considered our unique advantage. This is because in order for stem cells to function optimally, especially their immune and regenerative functions, balancing the sympathetic and parasympathetic nervous systems through autonomic nervous system injection therapy can greatly help create an environment where stem cells can work effectively.